Anesthesia is well positioned to fill the role of organizing and collaborating our perioperative efforts because we are the team that's here every day.
We're trying to build a culture of safety and patient priority. We want to make sure that we are giving the best anesthetic care that we can give to this community. We talk about it in our meetings, we talk about it on our daily huddle. Patient safety is our number one, and we want to provide the best anesthetic that we can give to every single patient.
My name is Ronald Kratz. I'm the chief anesthesiologist here at Penn State Health, Lancaster. This hospital opened its doors in October of 2022, and from day one, NAPA was here and provided 24-hour coverage. As we hired people within our department, everyone came from another facility where they all knew what the right thing to do was and the right approach to an issue. But from facility to facility, that varied. So how do we form a new team that works together in this environment?
Starting a new hospital, brand new hospital, new employees from different facets, like coming from different hospitals with different regimes already set up. He had to make it a unique place in terms of trying to mesh all these ideas into one to make the hospital run smoothly.
We also looked for people with a strong sense of community and willing to invest in that community, and people who could communicate, recognizing that not only do we need to communicate with ourselves as we build our own culture, but we need to communicate with the surgeons. We need to communicate with the perioperative staff as we build policies and expectations as to how these patients are best cared for.
I think collaborating with all of the different services is one of the most important things. I think goes back to teamwork. It's not just with the anesthesia team. We have to work with everyone here. And I think the best way to collaborate is to have effective communication with everybody.
As an anesthesia team, we collaborate with PACU, ICU, surgeons. We have bi-weekly meetings. So we bring all the information into those sessions to discuss what the needs are for the facility.
The relationship between the director of perioperative services, the chief of surgery, and the chief of anesthesia kind of sets the tone for the entire department. What stands out the most with working with NAPA Anesthesia Group and Dr. Kratz and Katie and the team is their focus on patient safety.
And as we have expanded from 1 room to 3 rooms, 3 rooms to 8 rooms, and now up to 9 locations, we have been able to hire the necessary team members to build our department, which has made all the difference.
We were managing between 80 and 100 to now current state, we're over 455 cases a month and growing. We're kind of setting the bar really high in the system. Our patient satisfaction scores are between 92 and 98, which is above the benchmarks and higher than anyone else in the system. Our first case on-time starts, we're right around 95%, which is huge. So we're getting a lot of great feedback from the providers on how well anesthesia is supporting those initiatives.
I think the blueprint for success is to not only know what your metrics are, but also to find out what's important to the other members of the team and work to establish and fulfill their metrics so that everyone feels like they're getting a win.
I think what excites me is that this is just the beginning. You know, we're still growing, we're changing, we're finding our little niche of what we're the best at here. And I think that's still a very exciting thing.
What we have done here is provide consistent care, good quality, consistent care. And I don't see that as coming to work. I see that as coming and doing something I enjoy.
I am a person who thrives on developing relationships with people, so it's been an absolute pleasure to be part of this growth in my home community.
The role of the anesthesia provider is to provide comfort to the patient. Patient safety is our number one, and we want to provide the best anesthetic that we can give to every single patient.